Hey everyone, I'm often asked what are the worst postural positions you can get yourself into. So I've got three that I deal with quite frequently. And the first is around the shoulders. Basically, it's internal rotation of the shoulder. Most people that work at a desk will have a position like that, and then to correct it, they'll roll the wrists out, but most of the shoulder is compressed in. That also causes the sort of forward position like that, and then we arch the neck to sort of look straight. Really bad for the neck, causes headaches, can cause thoracic outlet syndrome, which is a form of impingement where the nerves, veins and arteries that come out your neck and go through the arm are trapped by either the collarbone, the pec minor or the scalenes, which can cause pain, numbness and tingling and a weak grip. So people that will drop pencils, pens, handbags, whatever you want, it's actually really common, and it comes from that position. My advice, if you're ever exercising, never do something like an upwards row like that. You can if you want to build muscle, it will work, but it can also cause quite a bit of impingement. This position, it's called a Hawkins-Kennedy test. We put the arm into to test if it's got impingement. So it'd be like if you had an exercise where you just bent your finger back and pushed against the joint. Really hates it, doesn't like it. Any other type of shoulder press, I'd advise more. It's up to you, but that's just my opinion with it. The next one is an uneven hip sitting position. So if you cross your leg or if you sit on the wallet, it basically tilts your pelvis up, which causes, a potential scoliosis through your spine because everything has to compensate. Real easy thing, try not to cross your legs, try not to sit on your wallet, and try and sit squarely on your bum as possible. Obviously sitting isn't ideal, but we do have to do it. The standing version of that is popping out a hip. So try and stand on both feet and sort of stand straight rather than sort of tilting to the side. The last one is anterior pelvic tilt, where basically you roll your pelvis in and poke your bum out, shortens the sort of space between the vertebrae of the spine, and it can cause quite a bit of issues, whether it's a facet joint, which is the joints of the spine, an SIJ joint, which is a joint that the spine connects to the pelvis on the lower back, and it can cause all types of issues with the lower back, legs, all that sort of thing. So one thing that really causes that is sitting, because we sort of bury our bum into the back of the seat and then lean forward and then come back. So everything is just already overloaded through the lower back. You can always roll the pelvis underneath you to try and sort of cause some space. One gym exercise that is really common is a hamstring curl, particularly the laying face down one where you're curling up. Generally a good exercise for the hamstrings. The problem is when you start to increase weight, it starts to load up the psoas muscle, which is a muscle that its main hip flexor basically goes from the inside of the spine through to around the belly button through to the hip and helps lift that leg up. The problem is when you put a counter against that, so the bench where your sort of knee is pressed against it, when you activate that, the psoas starts pulling on the spine, which causes you to roll into that anterior pelvic tilt because there's nowhere for that leg to go, so it starts pulling down and then you cause quite a bit of pain through the lower back. Real easy thing. Just do a seated hamstring curl where you're sitting up. It's going to alleviate a lot of pressure on the psoas muscle and that anterior pelvic tilt. So those are the three main sort of postural positions that we all do to ourselves that are easily corrected with almost no therapy. So give it a go if you've got any of those. And for further videos, keep tuned to the Myotherapy Melbourne Facebook, Instagram and YouTube pages, and I'll see you in the next one. Cheers.